The following is a true story from someone I know that contacted me. They were forced onto a psych med called Abilify by the state. Basically, the courts demanded it. And this is something I've been trying to warn the chronic pain community for a while now, and I feel like a lot of my words go unheard, unseen, untouched, unmoved, just yelling into the void. It's not something that a lot of chronic pain activists even really bring up. You know, we talk about, like, we need access to our as I've mentioned many times on this channel, as a chronic pain patient, we need access to our opioid pain medications again. Like, the reality is the side effects of opioid medications are far less severe than the psych meds and many of the medications they want to use in place of opioid medications. The truth is that whether it's steroids, gabapentinoids, these medications have a lot of very negative side effects that cause long-term health complications, like underlying health complications. Even the over-the-counter stuff, like, I mean, now, when I talk about NSAIDs and Acetaminophen and muscle relaxers, what I'm getting is prescription strength. And as I detailed in a previous video, I went to a doctor saying, like, I'm exhibiting symptoms of renal failure, of my kidneys shutting down, which is life-threatening and could be cause for further medical intervention that's very expensive, by the way, such as dialysis or surgery to remove stomach ulcers, and constant throwing up of stomach acid can cause something called esophageal rupture, which is also life-threatening. Renal failure is life-threatening. But one class of medications that they keep throwing at chronic pain patients is psych meds. Many of these psych meds have chemical dependency, meaning if you stop taking them abruptly, you will go through withdrawals. I have been through many of those withdrawals in my life. I've been seeing psychiatrists and psychologists since 1992. I've been on many different psychiatric medications, and the reason why I'm not on them is not because, they don't instantly solve depression or bipolar or generalized panic and anxiety or whatever. That's not why. And I think a lot of psychiatrists like to pull that as like, they don't like their meds because it's not instant gratification. It takes time to develop a level in your system and could take several months before you start feeling the effects. No. The reason why I stopped taking those meds is because they literally were causing me to feel violently ill. All right, so these medications, they don't produce euphoria, they produce dysphoria. Like, several of them literally made me feel like I might as well have been one of the Radium girls. Like, I literally felt like my hair and teeth were going to just start falling out. And possibly even like this was before I even knew that the radium girl thing even existed. I didn't know, but some of these medications I would even describe to people. I feel like I'm taking like rat poison. Like I feel like my bones are just going to crumble into dust and my teeth and hair are going to fall out. Violently ill. A lot of them have very severe long-term consequences that include diabetes, high blood pressure, heart failure, renal failure. There's a condition where chunks of fat will float around in your bloodstream, which puts you at very high risk for a heart attack, or even a stroke. Some other issues with psych meds include muscular dystrophy, cognitive malfunction, memory loss, Alzheimer's, dementia. These things are terminal. And so when people go on psych meds, they need to understand you shouldn't be going on psych meds because you're depressed that you're going through a divorce or someone you love died. It's perfectly natural to feel sadness in those situations. Now, if you're not dealing with that sadness and you're having bad thoughts, then maybe it would be recommended that you go on a medication. But I have been an advocate that psychiatric meds should not be used long-term at all because of the underlying health conditions that they can produce, which are terminal. And so you have to think we are giving people medications to adjust their mood because societally we don't like these mood disorders, like at the cost of their life. Like it could kill them. And so for me personally, I got to a point where I was like, I'm not going to kill myself. I'm not going to give myself underlying health conditions that are terminal just because society doesn't like my attitude. That doesn't seem justified to me. A lot of people have to understand, and as far as psych med treatment goes, we're not very advanced. We're not as medically advanced as I think a lot of people would like to think we are in many aspects. Like nerve damage, there's no real way to repair nerve damage. Like I have motor nerve damage all up and down my arm and in my chest and my neck. There's nothing you can do. That's your new norm. We're limited. But especially when it comes to psychiatric meds and treatment, is that a lot of the meds that we have are based off of an idea within the psychological community, like especially first gen psychiatric meds. A lot of them were not made with the idea of being humane in mind. A lot of them were made with the idea of just getting the patient to be subdued, sedated, or, in some way. And there have been doctors who have talked about using Haldol to chemically restrain patients. This comes from a very old idea of psychiatric treatment. And a lot of these drugs, psychiatric drugs, is pretty much what they do, is they're just chemically restraining you. And that was not, they didn't come up with that because it was humane. Some of these, the idea behind these psych meds came up around, when we had psych wards and psych patients were treated very inhumanely. So they didn't really care if the psych med was humane or not, and we're still kind of in that boat. We don't have access to a lot of psych meds that are safe. They can absolutely produce underlying health conditions that are terminal, meaning they will be the cause of your death. And if you look at the list of side effects and long-term effects of psych meds, it's long. It doesn't matter which one it is. All of them. It's a long list. Many of them have had class action lawsuits. There are even medications I've been on that are no longer on the market because they were so inhumane in the long-term and side effects they can produce. Geodon being one of them. Geodon actually even, I guess, is still even used today, even though it's had class action lawsuits filed against it. But Scott Wayland, who had depression, he was treating his depression with heroin, but I don't think that's a good idea. I don't think you should treat your depression with heroin. It would be effective in that, I'm not gonna lie. But when he got clean, that was one of the antidepressants he was put on, and there's a video recording of him trying to sing songs where he's all out of key, all out of tone, everything, just messing it up. People actually thought he was back on drugs when that happened. No. That was the cause of a particular psych med, an antidepressant called Geodon. I've been on that medication. It's absolutely horrifying to be on. It, caused, personally for me, it caused my blood pressure to skyrocket. It caused me to have a sensation like the muscles under my skin were constantly quivering. Anytime I'd itch my nose, even as simple as this, it would just start gushing blood. I would get a sharp pain in my chest, which I would describe. I would describe it to doctors as, like, when they ask me about it, it feels like a pebble passing through a heart valve. They say, "Oh, that's not possible. Heart doesn't have sensations." Well, I don't know. It's sharp pain in my chest. But I was 120 pounds, 17 years old, had no health issues, taking that Geodon, and I had a blood pressure of almost 200 over 90 on that medication. And so, I had to quit that medication. I went through the withdrawals of that medication, and ultimately after that medication got out of my system, my blood pressure returned back to normal. But gabapentinoids, they produce chemical dependency, and they can cause a lot of problems. They can cause memory loss, dementia, Alzheimer's. A lot of these psych meds, so it feels like people aren't listening. And it's wild to me that, the side effects and long-term effects of opioid therapy for pain management is constipation. That's it. And then, of course, the chemical dependency. If you stop taking it, you're going to have withdrawals. But that's any psych med too, as well as gabapentinoids. They do the same thing. It's just the psych meds and the gabapentinoids don't make you feel good. They make you feel like trash, like violently ill, violently sick, very sick. Opioids don't tend to do that. The risks of opioids are actually a lot less than psych meds. So it just seems strange to me that society seems to only want to focus on the risks of opioids being used as pain management therapy, but they don't want to focus or pay any attention to the risks and long-term risks of psych meds being used to treat pain. I don't know why it only matters if a drug causes chemical dependency or has this series of risks. Society doesn't seem to care unless it's very, very, very specific substances, predominantly opioids, benzodiazepines, and amphetamine-based medications for ADHD. So I find that strange, particularly when the medications that are bad because they're illicit drugs, and I mean, it's being prescribed by a doctor. No, it's not illicit drugs. These things do have medical application. That's being ignored. And it's just strange to me that they'll completely ignore the risks of these class of medications, then hyper focus on these specific ones over here. They'll ignore that this class of medications produces chemical dependency, but they hyper fixate on these ones over here. And I find that strange. I don't know why. I find that to be intellectually inconsistent and hypocritical. But it just feels like nobody wants to listen to this. Nobody wants to hear it. But it's true. And so this friend of mine, he is a chronic pain patient. He's also a he also has some psych issues, so that is why he is on the psych med, is for the psych issues. But the medication that he takes for pain that was given to him for pain is it was gabapentinoids. At first he was on gabapentin, now I believe he's on pregabalin, which is Lyrica. And he has since developed a seizure disorder from the gabapentinoids, and has come to find out he thought he had a hernia. He doesn't have a hernia. Well, he'll explain that in what I'm about to play. I'm going to bleep out names and stuff because, you know, privacy and whatnot. But I think this is an important story for people to hear, to understand. I'm not making this up, and people need to understand this about using these other alternative medication therapies to treat pain. They need to understand what this stuff does, what it is, that just because it's not an opioid doesn't mean it's safe. You guys have to get this through your head. You have to understand this, especially coming from somebody who's been seeing psychiatrists and psychologists since 1992 and has been on pretty much almost any psychiatric med you can name. And that's one of the reasons I turned away from them, is I got tired of feeling violently ill all the time. And I've read the books that come with those meds, and man, the underlying medical issues psych meds cause are no joke. And even with the NSAIDs, acetaminophen, and muscle relaxers, like, I don't want renal failure. I don't want liver failure. I don't want stomach ulcers. You know, like, I would prefer to be on an opioid. And yeah, that means I'll have a chemical dependency to it, but that's not a foreign idea to me, being a person who has been on so many psych meds, because that's the usual spiel when they give you a psych med. This produces chemical dependency. Do not stop taking it. You have to be tapered off. Yada, yada, yada. Every psych med comes with that warning. Every single one of them. Do not stop taking this immediately. It's not because, oh, you'll relapse into a psychiatric. That is an issue. But the other issue of why they tell you don't stop taking this medication abruptly is because you will go through withdrawals. You will. The thing is psych meds don't make you feel good. They make you feel sick. Violently sick. Anyway, I want to play this for you, and then I think there's some things I'll clarify. I'm trying to keep this video a little short, but I'm not too good at keeping videos short. So I'm going to play that for you now. So you can, and this particular friend of mine, by the way, is a bio-chemist, and he knows these medications in and out, down to the molecular structure and how they even interact with the body. He has even come up with ideas of molecular compounds for medications himself. So, Now, I'm not trying to make an appeal to authority. I'm just saying he has a authority, some sort of authority on knowledge when it comes to biochemistry. All right, so I'll play it for you now.
Hey, what's up? I have something kind of humiliating to tell you. It ends up I don't have a hernia. It's just that Abilify mutated my body so much, and I mean, of course, drinking doesn't help, but I have so much visceral fat that it's like pushing on my organs, and that's why I can't bend over and shit, and why things I felt are actually like either the fat bulging out from under my, or even my liver bulging out. But at least I don't have cirrhosis or anything. That's good. But like, oh no, you don't have a hernia. Here's fat ass. I'm like, and I know it wasn't from drinking because I started getting this way when I was still on probation and fucking court ordered to take goddamn Abilify, and fucking, I'm just really fucking, these goddamn poisons they put you on, they all have side effects and shit. I wouldn't have seizures if it weren't for fucking gabapentin. I wouldn't be like fucking fat and unable to bend over if it weren't for fucking Abilify, and it just sucks, man. Fuck. You know what's funny, dude, is like if they weren't addictive, opioids have less side effects than both of these fucking drugs. Jesus Christ. I mean, I'd rather just be unable to take a shit. In fact, I'd like that. I'd like to just only have to take a shit every 3 days and then just wipe some blood off, and that'd be it. I'm sorry, I'm just bitching. Anyway, but yeah, it's very dense visceral fat, and I can tell that, like, you know, it's kind of weird for straight guys to poke each other's bellies, but I can tell because if I touch my man boobs or my butt, it's like flabby fat, but then if I touch my belly, it's like it feels like it could take like a freaking baseball bat to it. Alright, sorry. I was whining.
So, as you can see from there, what he's talking about, the visceral fat buildup around his liver, that's actually a common side effect, not just of Abilify, but many psychiatric meds do that. Depending on the med, they can do different things, but it's not the only one. And actually, the seizure disorder that he has developed from the gabapentinoids, that's something that can occur as a withdrawal symptom, or long-term use of gabapentinoids is developing a seizure disorder, or people who have gone through withdrawals of gabapentinoids actually will have seizures because, again, gabapentinoids are not something that you can just stop taking abruptly. You have to be tapered off. You will go through withdrawals. They're very, very unpleasant. Same with Abilify. Abilify is not something you can just stop taking abruptly. You will go through withdrawals. It's very unpleasant. Other things that psych meds can cause, like I said, is it's other fat-related issues like chunks of fat drifting around in your bloodstream. There's a medical term for that. I don't remember what it's called. You're at higher risk for diabetes, stroke, high blood pressure, rapid weight gain. It's a very common thing for psych meds to cause rapid weight gain. You could be eating healthy, you could be living healthy, and you could go from being 120 pounds all the way up to 160 in 3 months. That's something I experienced personally in my late teens, early 20s due to psych med medications. So the high blood pressure, the diabetes, higher risk of stroke, heart failure, heart attack. Those are issues that come with psych meds. The gabapentinoids, you develop memory loss, dementia, Alzheimer's, neurological dysfunction like brain zaps or brain snaps, shakes, tremors. Again, those are other side effects of taking psych meds. They can mess up your central nervous system really bad. And so what he's telling me in there is that, he thought he had a hernia. Turns out it's not a hernia. It's just due to taking the psych med Abilify, he's built up, which Abilify is known to do this, build up visceral fat around his liver. And so it's not a hernia. It's just visceral fat that's built up. That's a very common side effect of Abilify. Another really scary side effect of Abilify and many other psych meds is something called serotonin syndrome. If you get serotonin syndrome, you stop feeling anything. You're not able to access the vast spectrum of human emotions. People might say that sounds kind of like it turns you into a sociopath. Not really. You don't feel anything. You don't know how to react to things anymore. You just kind of like, I know I should be sad, but I like if you tried to express sadness, you might be like, yes, I am very sad. And that's it. I mean, there's no happiness, there's no sadness, there's no content, there's no complacency, there's no anger, there's no love, there's nothing. And you can also start having an issue where it's really, really hard to articulate the thoughts in your mind. That's kind of one of the beginning stages of serotonin syndrome. It can actually worsen or cause psychosis, like symptoms, or even develop a disorder for it. So, we should not. These psych meds that produce what you just heard him talking about, this has been medically diagnosed, and diagnosis, the reason why, is from the psych meds. Okay. We should not be giving these to chronic pain patients. They are dangerous. It's just like I've kept saying over and over again, just because it's not an opioid doesn't mean it's safe. What I find interesting is, what I find just bullshit, is that society, for some reason, looks at these psych meds. They may produce chemical dependency. They don't care. They have massive amounts of side effects and long-term effects that threaten your life. They don't care. And it seems like the only reason they care that opioids cause chemical dependency, and even though they don't have really the only side effect or long-term effect of opioids, there's respiratory suppression. It's really only if you take too much. You can overdose, but you can also overdose on psych meds. So, you can overdose on pretty much anything. So I don't find that as a viable excuse. Just don't take too much. And people do develop obsessive compulsive uses towards psych meds too, where they just habitually take them until they have seizures and vomiting and up to death. So it's just the only real side effect of opioid therapy for pain is constipation. That's it. It does not cause damage to your internal organs. It does not increase it's not going to give you diabetes. It's not going to give you heart failure. It's not going to give you high blood pressure. It's not going to cause fat cells to drift around in your body, in your bloodstream. It's not going to cause buildup of visceral fat, even if you're being healthy, eating healthy, being active, etc., which psych meds do. The thing that's just bullshit is for people to only focus on opioids chemical dependency because it produces euphoria instead of dysphoria, and then say, well, psych meds, even though they produce a chemical dependency, it's okay because they cause dysphoria. And then that's where the term addiction becomes all skewed. It doesn't produce addiction because it doesn't cause euphoria, it causes dysphoria. Well, some people do develop addictions to that. So no, you're wrong on that. The thing is, though, is we're ignoring a litany of risks on the psych med side that, they're not minor risks. It's not just constipation. It's literally like, this is going to kill you. Your life expectancy will be shorter because of these meds. And that's okay when it's a psych med. But even though all the negative risks of opioid pain management therapy are much lesser, the risks are the only things that society fixates on when it comes to opioids, benzodiazepines, and ADHD medications that are amphetamine-based. And nobody wants to look at the litany, it's miles and miles long, that are extremely horrific underlying health conditions, or psych meds, steroids, even the use like Haldol, which is just that's a first gen antipsychotic, worst things you could use. You have trigger point injections, nerve blocks. There's the pharmatech, things like spinal stimulators. Those are very dangerous. You can end up paralyzed. Epidurals, you can end up paralyzed. You can end up with spinal meningitis. You can end up with spinal adhesive arachniditis. You have the Botox injections that could literally cause all the muscles on one side of your body to just kind of stop working. And like if I had a Botox injection into my neck, this whole side of my face could just droop. And it can kill you if the Botox gets into your, if it gets into blood circulation. There's instances where it can absolutely kill you. And nobody, and on top of that, the pain relief that you get from these things is crap. I mean, pay $3,000 and get 4 hours of pain relief. Why? When you can pay $20 or $30 for a bottle of opioids and get pain relief for an entire month, and not have high blood pressure, not have diabetes, not be at higher risk for stroke, heart failure, heart attack, so on and so forth, memory loss, seizures, dementia, Alzheimer's, constipation. So why is society saying all these negative things about psych meds? Well, that's okay. But when it comes to opioid therapy and even benzodiazepine and amphetamine-based medications for ADHD, everybody is hyper-focused on the risks and just wants to completely ignore the medical benefits of them over stigma. We need to stop doing that. There needs to be an open, honest discussion about this stuff and make people aware. Because I think when they buy into the anti-opioid propaganda, this is the side they're not seeing. So, make no mistake, this is not about being pro-big pharma, pro-capitalism. No. This is about right to bodily autonomy. This is about the poor and ill treatment of chronic pain patients, denying them quality of life, denying them functionality, denying them their bodily autonomy to say, I don't want a drug that's going to give me, regardless of if whatever's on the table is going to shorten my lifespan. Shouldn't the patient have some kind of autonomy to say, I don't want a drug that's going to give me dementia, Alzheimer's, and memory loss and seizures. I would rather have one that, constipation. I don't want one that's going to give me diabetes, high blood pressure, stroke, heart attack, renal failure, liver failure. I would rather have this one. I know it's addictive. I know it produces chemical dependency, but I'm okay with the constipation. Or maybe it's the other way around. Maybe you don't want to do the opioids, but you're comfortable. You're okay with the dementia, the Alzheimer's, and the seizures. People should have a choice. Like maybe becoming a chronic pain patient should be more like when you find out that you have cancer, you get a pamphlet of treatment options that goes over the risks and benefit of each treatment option. And for chronic pain patients, that pamphlet should include opioid therapy, steroidal therapy, which, by the way, anti-inflammatories are going to be useless if you don't have an inflammatory-based pain condition. Just letting you know. So I don't know why they're giving NSAIDs to people with nerve damage. Because nerve damage is not usually, typically, it can be, but not always. Most of the time, excuse me, most of the time it is not inflammatory based. So taking an anti-inflammatory isn't going to do anything for your pain. If you're experiencing nerve pain, nerve damage. So, that would be cause for a true analgesic, which there's only two. There's Tylenol, which is crap. Tylenol is great if you have a fever, if you have a headache. You do not, the last thing you want is after open heart surgery, the doctor walking in saying, oh, you must be in a lot of pain. Here's a Tylenol. So, and Tylenol shouldn't be used long term because Tylenol attacks your liver in 3 different ways. It'll destroy your liver. NSAIDs will destroy your kidneys, which is something, I've been experiencing with the urea, breath, vomiting, stomach acid, blood, bile, and shitting blood because my kidneys were malfunctioning due to too much NSAIDs and Acetaminophen and muscle relaxers because, it's wild that when I told the doctor that and she was like, well, I guess you're doing everything you can. Like, if I was not a chronic pain patient and went into a doctor and said, I'm taking 5,000 to 6,000 milligrams of Acetaminophen a day, I have urea, breath, and vomiting, stomach acid, blood, bile, shitting blood. My left eye is starting to twitch. I think I might be at an increased risk of stroke. If I was not a chronic pain patient, that would be cause for immediate medical intervention as somebody who is self-harming. But because I'm a chronic pain patient, it's okay that I'm killing myself as long as I'm not killing myself, but on an opioid. That doesn't make sense. If I'm on an opioid, I'm not having renal failure, I'm not killing myself, but because it's an opioid, that's bad. That they would prefer me to be on a pain medication regimen that's killing me just because it's not an opioid. How do you rationalize that? Yeah. What the fuck is wrong with society? We need to stop doing that. pain patients deserve rights. Basic human rights. And by the way, another thing that a lot of pain activist groups don't seem to want to bring up. According to the World Health Organization, which Trump pulled us out of, I don't appreciate that. According to the World Health Organization, opioids are a basic human right to treat pain. And they even have it broken down into different categories. You know, like you got the acute pain treatment, usually is your codeine, tramadol, Vicodin kind of thing. Broken leg type stuff. And you have your chronic pain, specifically chronic pain was listed. Talks about codeine and time-release morphine, like Oxycontin, Percocet, hydrocodone to treat chronic pain. The World Health Organization says that's a basic human right. And then it goes on to say that end-of-life care, like things like hydromorphine, Dilaudid, fentanyl should be reserved for end-of-life care because of how strong they are. They're far more addictive, far more powerful. So, World Health Organization even says access to opioids to manage one's pain is a basic human right. Not a right, a basic human right. Nobody's talking about that either. That's the World Health Organization. I don't know how we got here. I really don't. It's bad. Like, share, subscribe, comment, all that. I mean, like, really try to raise awareness of this. Like, for some reason, nobody wants to pay attention to chronic pain patients. Just keep sweeping us under the rug. They don't want to acknowledge the increase rate of suicide within the chronic pain community, which it has significantly gone up, and epidemiologists want to study it, and the anti-opioid people keep trying to block them. And that's coming out of major universities like Brown and WashU and stuff like that. And society seems to only want to focus on the risks of opioids and completely ignore the medical uses of them. And that is not doing anybody any favors. It's damaging. We can do harm reduction. We can do that and help people with OUD without taking away pain patients' access to opioid pain medications. I'm not walking into the doctor going, oh, my back. No medical records. No. My medical records speak for themselves. And before the opioid guidelines got as strict as they are now, they did prescribe me opioids and then one day just stopped. And it's been damaging to my body, to a lot of people. It's like, why are we ignoring chronic pain patients? Why are we not considering the rights of people who are disabled by chronic pain? People who are this is a very vulnerable population. Talking about people who have restricted function. You know, it's not like we can do a 1,000,000-man march here. We're struggling to get into the shower. We're struggling to get to the bathroom. And a lot of people who are just debilitated by chronic pain, it's not like they have a lot of money. They can't work. And filing for disability is not easy. There are people who have been trying to get disability and been unemployed. If you have family members that pick you up and start taking care of you, you're very lucky, you're very fortunate. If you have a spouse that's willing to take care of you and can afford to do that, you're very lucky. A lot of people end up going homeless while on the waiting list trying to get disability. And, my thought is that if you can work, you don't need to be on disability. You don't, I hear people trying to get on disability and they can do things that I physically can't. And it's just like, why do you need disability? Like you can do this, that, and the other. You could get paid to do that. Why do you think you need disability? Like it takes me 6 hours to make coffee, brush my teeth, and take a shower. Right now, as I'm recording this, I haven't even taken a shower yet. So, I'm in a perpetual state of getting ready. And there are people that are worse off than me. I even know somebody with lupus that's been trying to get it. Like there are people who are disabled and they've been trying to get it for 10 years. And now with this Trump administration, there's the fear that disability may not even be an option available. And what are all these people supposed to do? Becoming disabled from chronic pain is not something you plan on. It's not because you make not typically because you make poor decisions. I didn't know this was happening to me. I was just doing a job. I didn't even know what neurogenic TOS was. I didn't know that existed. I thought it was a torn rotator cuff or something. I had no idea until my arm started to literally shrink in size and I started doing research. I was like, oh, fuck. This is for the rest of my life. Now I have a 5 to 7 pound weight limit. And my range of motion out of 180, I might only be able to get like 40 or 60 degrees out of 180 degrees. So I cannot reach in any direction away from my body, especially overhead, reaching past chest level, and no repetitive motion, which includes texting and typing for more than 15 minutes at a time. I have moments where my arm just stops working, or my hand just stops working, or my fingers stop working because the nerves cannot communicate. I have atrophy. I have entire muscle masses that are gone because they can no longer communicate with my brain from nerve damage. So, I didn't ask for that. I didn't choose this. I don't know what I'm supposed to do. And people out there seem to think there's an answer that doesn't exist. I don't know what people are thinking. If somebody says, oh, we should get rid of the SSA, you should immediately be like, that person's a lunatic. Unless you are prepared to take up any friends or family members you have who are disabled or retired and start taking care of them yourself. Then you better keep your mouth shut. And a lot of the times people say they would do that, they don't. I've come to find that becoming disabled, I've become very, very isolated. It sucks. This is not fun. It's not fun. And I've come to find out my isolation might even be getting worse because, well, I don't have an income. And the transmission in my car is slipping. Not that I drive very often. It's very painful to do that. I can't drive for long periods of time. But it means I'll have to start relying on somebody to take me to the store to pick up my meds or go to doctor's appointments, because even while you're filing for the disability, the SSA expects you to continuously be seeking medical attention, even though you can't fucking afford it. So, we need to be paying attention to chronic pain patients and what we're saying, and we are saying, you need to give us our opioids back. I really want to be able to go back into my doctor. And not a pain management specialist. Those people are expensive. It's a $90 visit, $3,000 to $5,000 for a procedure, and you'll have nothing to show for it in the end. Sometimes it doesn't even treat pain at all. And the most pain relief I ever got out of it was 4 hours. Can you imagine paying $3,000 for 4 hours of pain relief? The same hours of pain relief as taking one hydrocodone, of which you could get a bottle of hydrocodone that would last you an entire month for like $20. And I can no longer just go to my primary care physician and have her prescribe that to me, knowing I have this condition and knowing it is definitely a chronic pain condition. It's a very high level pain condition. No one with this condition rates their pain under 8. Nobody. We need access to our opioid medications again, and not through a pain management plan. A doctor's job should not be to judge. It's to treat. Plain and simple. I don't know how we got here, but it needs to stop. So, we need to be having that conversation.